Hi, PsyQ community. I'm Dr. Miranda Fisher, Medical Science Liaison at Otsuka Pharmaceutical, and I am here today with Miss Laura Kaponer. Laura is a certified peer support specialist, a mental health advocate, and a social media blogger. And she is here today for this short podcast to discuss her perspective as a patient living with borderline personality disorder. So thank you so much, Laura, for being here today.
Thank you for having me.
Yeah. So oftentimes patients with borderline personality disorder are misdiagnosed with other conditions. So why do you think this is? And how was your diagnosis finally uncovered during your treatment journey?
With most of my peers that I've come across that have borderline personality disorder, every single one of us was diagnosed with bipolar first. I even worked with psychiatric professionals that said that they were very similar. But if you look at the different symptoms, they're actually very different conditions. The thing with borderline personality disorder that is very unique is it has 9 criterion of symptoms, and you have to meet 5 out of 9 of them to get the diagnosis. What makes it so tricky is it could be any combination of those 9. So it can present so differently in multiple people. I think with any mental health diagnosis, the professional really needs to take the time to get to know the person. I don't think a diagnosis can be put upon somebody within a few visits. I also think it's essential to try to get a perspective from loved ones in the people's life so that they can get more of a clear picture, because most people with mental illnesses do kind of have a distorted reality and they don't maybe see things the way they are. My diagnosis actually came from an article in Oprah magazine that my parents came across, and very delicately, because sometimes dealing with me is like walking through a minefield, approached me with the article and said, "This sounds a little bit more up your speed than the bipolar, because all the treatments and all the medications that they were trying to give me for bipolar just weren't working, and we couldn't figure out why." So I read this article, and then I found a facility that specialized in it about 2 hours away, and I traveled once a week. It's called dialectical behavior therapy, which was created by Marsha Linehan, and it's specifically for people with borderline personality disorder. It's a version of cognitive behavior therapy, and they have this specific program that includes individual one-on-one therapy and group therapy, and you just learn different kinds of coping skills. These coping skills are amazing, and they can be used for anybody with any diagnosis or even not with formal diagnosis. But getting the right fit really helped me figure out what trajectory to go with my recovery and to try to find mental health professionals that specialized in borderline personality and truly understood the depths of it.
Yeah. So what are some of the specific challenges that you found as far as managing borderline personality disorder that may not exist for some of the other conditions?
I think there's just so much misunderstood about it at this point, because once again, professionals that are trained in this field don't fully understand the difference between borderline personality disorder and bipolar, which once again are 2 very different conditions. I think the challenges that I faced is that I'm trying to convince people that that's the condition I have. And when you go to the emergency room or when you go to other specialists and everybody wants you to go over your medical history and you try to explain borderline personality disorder, a lot of them don't understand, or they hear the personality disorder part of it, and there's a stigma that those aren't really mental illnesses. There aren't specific medications for borderline personality disorder, but there are medications that can help with the emotion regulation and the depression. So for me, it was learning about my condition and the self-advocacy that I've talked about in our previous podcasts, trying to understand and understanding how my symptoms and my behaviors affect others, knowing that this condition is not my fault, but it is my responsibility to manage the symptoms. I also think with any medical condition, mental or not, It is the person's responsibility that has the condition to educate the people in their lives about their symptoms and what will help and hurt them in the recovery process.
Yeah, so you had just mentioned some of the stigma that you faced, even from healthcare providers. So how have you dealt with that in the past, or how do you currently deal with stigma from others?
It's still an uphill battle. The thing with mental illnesses is it's a brain disorder, and that's the organ that we understand the least about because you can't really do stuff on it to figure it out while the person's still alive. There's some tests, but they're not covered by insurance and they're considered experimental at this point. Uh, it's hard because it's considered an invisible disability. And the way I explain it to people is the wiring is off in my head. So certain things don't connect, certain pathways don't follow the way that they should, kind of like when you're driving on a highway and there's detours, and the detours maybe take you all the way around. So there are just some things that I don't understand. And I'm in therapy and I'm taking medication and I'm working on my skills, but I'm never going to be 100% not symptomatic. So just trying to hope that the people in my life will be patient. A big thing is I'm not aware of a lot of the behaviors I do. So I'm very open to feedback and I try to let the people in my life know, please open up to me about if I've said or done something that is inappropriate or maybe harmful to our relationship or things that I'm doing in general. Because most of the time I don't even realize I'm doing it. So I think a lot of it's asking people for the benefit of the doubt, realizing that I'm not intentionally doing things to cause people to be uncomfortable or to hurt other people's feelings. I just don't know sometimes, and that's one of the symptoms.
Mhm. Well, thank you so much, Laura, for sitting down with me today and providing your valuable perspective and insight on living with borderline personality disorder. And so just to finish up today, please feel free to check out our PsyQ website and the Patient and Caregiver Corner, where Laura here is providing her insight and a series of podcasts on all topics related to mental health. So please keep a lookout on that. And thank you so much for listening.